Hi, this is just a short presentation looking at Unit 13, Assignment 2, first criteria, which is P2, the development of the ideal occlusion or formation of the ideal occlusion. So P2, describe the stages in the formation of an ideal occlusion, and we've got an excerpt from the British Orthodontic Society document managing the developing occlusion, and that can be, the link is available on the bottom of this slide. So we've got a variety of different groups of teeth that are erupting, first beginning around the age of 6 years old, eruption of the lower central incisors. And then we've got groups of teeth erupting at various stages, at various ages from 6 to 12. It first occurs between 6 and 8 years when the permanent incisors and the first permanent molars are erupting. Second, between the ages 11 and 12, second stage of eruption is where permanent canines can be seen to erupt, premolars and second molars erupting. You've got an image there of what's going on, a variety of deciduous teeth and permanent teeth pushing through. It will be remembered that at this stage, the dental age of a patient can differ widely from the chronological age. So if there is any delays or in eruption, there might not be any specific consequence at this stage. Permanent teeth are usually larger than the corresponding deciduous teeth, so there is an issue with space, and as the person grows, as their alveolar grows and their oral tissues grow, they accommodate accordingly the different sized teeth, the secondary teeth coming through. The extra size of the permanent teeth is accommodated in a number of ways, as we've just said: spacing of this deciduous dentition, growth of the alveolus, eruptive path of the upper incisors, so they can change their pathway to according to what space is available. Increase in width of the dental arches occurs in two phases, one being during eruption and later on with the permanent eruption of the canines. Changes in eruption patterns could indicate an abnormality and could be investigated using radiographs. But in the majority of children, the train of thought is that there will be some overcrowded, and positions of the teeth might mean that they're crooked, and generally that can rectify itself with age and growth, and there might not be any other treatment required than just reassurance at that moment. And we talked about the second phase occurring. You've got a person between the ages 11 and 12 with canines, premolars and second molars are pushing through and erupting. Premolars are actually smaller than their deciduous teeth, their deciduous counterparts, and space can be taken up by forward movement of the permanent molars. So effectively everything's pushing around to find their space and to find their positions. So there was your class 1 occlusion, which is the ideal. Mixed dentition is characterized by eruption of two groups of teeth. Lower canines and upper and lower first premolars all erupt more or less together at the age of 11. And crowding is the cause of a lot of issues